Like New York Martian landing an American today would be normal to be overweight and obese, because that's what Americans are. It doesn't mean it's optimal.
That's right. And so, in fact, an ALT upper limit is 25. If you're African American, an ALT upper limit is 20.
Mm-hmm.
So if you see an ALT above that, you got a problem. And you don't necessarily know why. And your doctor's looking at it and saying, well, you know, your ALT is 30, you know, it's below 40 or 50, you know, then no problem. And so your doctor's missing it.
Yeah.
So that's the second test.
And those are cheap. These are cheap tests.
These are cheap tests. These are tests that are normally done on standard chem panels. The next test is uric acid, as David Perlmutter and Rick Johnson, you know, are espousing. Now, uric acid is the breakdown product of purines. So, if you eat a lot of meat, you will get a higher uric acid. It's true. All right? And of course, everybody with gout knows this. Benjamin Franklin knew this. Okay? He wrote an ode to his gout many years ago. But it turns out sugar also increases uric acid. Now, how can red meat cause increased uric acid and sugar increase uric acid? Red meat and sugar don't look alike. Well, in fact, in the liver they do. And the reason is because they both cause an increase in ATP being converted to ADP, ATP adenosine triphosphate being converted to ADP adenosine diphosphate, which then goes down the breakdown pathway to uric acid. So uric acid is a proxy for both red meat and for sugar. In our society, it's actually a proxy for sugar.
Mm-hmm.
Now, uric acid is bad for two reasons. One, it inhibits an enzyme in your blood vessels called endothelial nitric oxide synthase, or eNOS. This is your endogenous blood pressure lowerer, keeps your blood pressure down. And so when your uric acid rises, your blood pressure rises. And it is the reason why sugar is more important for hypertension than salt is. When you actually look at the data.
Yes, thank God you're saying that.
Salt restriction, sugar restriction actually causes a bigger decline in blood pressure than salt restriction does.
Yes, thank God. I mean, I've seen this over and over, that the cause of high blood pressure is not necessarily salt, it's sugar. And when it's resistance is driving the high blood pressure in the first place.
Indeed. And insulin also prevents you from being able to excrete sodium. So the higher your insulin, the more sodium you hold on to at the kidney, which raises your blood pressure too. So by fixing the sugar, you're fixing the insulin resistance, you're fixing the uric acid, and you're lowering your blood pressure virtually overnight.
Yeah, and that's why people who stop sugar and starch, like they just pee a lot because they lose the sodium because their insulin goes down and they start peeing a lot of this little fluid, which is water weight, but that actually is a good thing.
That's a good thing. We showed in our 43 children study that these kids' blood pressures went down by 5 points in just 10 days with no change in sodium.
Yeah, it's true. Yeah, it's true.
So that's one reason why uric acid's important, is because of the blood pressure thing. But the second reason uric acid's important is because uric acid blocks an enzyme that are in your mitochondria. Carnitine palmitoyl transferase 1, CPT1. This is an enzyme that regenerates a transporter, carnitine. Carnitine is a transporter for fatty acids from the outside of the mitochondria to the inside of the mitochondria so that they can be burned for energy. If you poison that enzyme, you don't regenerate the carnitine, you can't transport the fat into the mitochondria. The mitochondria become dysfunctional, and guess what? You have buildup of fat in your cells because you can't burn it. So uric acid's a bad guy in the story, and sugar makes uric acid. So the problem with uric acid, just like the problem with ALT, is the interpretation. If you look at the lab slip, it's 7 is the
forget it.
normal. Wrong. 5.5.
Yeah.
Anything above 5.5, you got a problem. So,
by the way, what should fasting insulin be? Because I think we didn't talk about the number there. But it's important because it's what your doctor's going to say is normal and you it's normal and not do the same thing.
Agreed. Fasting insulin should be less than 10. Optimally, if
Yeah.